Hello everyone, welcome back. So in this video we are going to learn about roles and responsibilities of a hospital pharmacist. So generally the head or the director of the pharmacy department, he will be the responsible person for ensuring whether the functioning of the pharmacist and the pharmacy department is carrying out in a proper way or not, and he will be involved in ensuring the duties and functions which are assigned to the trainee pharmacist as well as to the senior and junior pharmacist are carrying out efficiently or not. On one hand he will be responsible towards its staff, and on other hand he will be responsible towards the hospital administration, whereas the functions and the responsibilities of the personnel working in the department is divided into the area wise. They are divided into two types, the inpatient and the outpatient. So in inpatient again they are further divided into four types: central dispensing area, direct patient care area, then patient care area, and lastly general responsibilities. So in a central dispensing area, the pharmacist will be responsible for ensuring that all the medications which are stored and supplied or dispensed, they are correctly dispensed or not. So this responsibility will be under the pharmacist. Next, he will check the accuracy of the dosages, especially in the IVs and the unit doses, and he will also check the accurate techniques are used or not. Accurate techniques are used in for preparation of the extemporaneous preparations. So all these things he will be having a check on all such things. Next, he will keep the proper records and preparation of bills. So in this the pharmacist will keep an eye on the records as well as on the bills, and like the equipments will be there, the dispensing records will be there. So it's his or her duty to keep an eye on them and to um, store all such records and bills, and he will coordinate over all the pharmaceutical needs of the patient care areas. He will be involving in the establishing policies and procedures, whether they are following or not. He will be having a responsibility for ensuring all such activities. He will be responsible for maintenance competence in this. The junior or the senior pharmacist, he or she, they have to keep themselves updated with the information regarding the drugs which we are using in the hospital, like the formulary. And next he will be communicating with all other staff regarding the new developments in areas, and they will be involving in assisting in evaluations of the employees. Then the pharmacist, he will be responsible for ensuring the new personals whoever are appointed in his or her section, whether they are trained or not, and especially in the policies and procedures. Then he will be coordinating the activities of the area with the available staff for making a possible use of the personals and the resources. This was about the central dispensing area, and the next is the patient care area. So here in this the pharmacist will be the in charge of the whole section. Whatever the section has been assigned to him or her, he will be sole responsible for each and every activity. So in this he will be maintaining a liaison with the nurses, because the nurses are the only persons who will be involving during the administration of the medications to the patients. So he maintains a liaison with them. Then he will review the drug administration in each patient periodically, and then he will ensure that the patients are taking medication and according to the charts which they have given to them. So charted medications will be given to the patients. So he will review all the medications administration. Then he will provide instructions and assistance to the junior pharmacist in dealing with the difficult patients. He coordinate with overall pharmaceutical services. Next is direct patient care areas. In this, his responsibilities involve identification of the medications brought into the hospital by the patient. Then he will obtain the patient's medication history. Then he will assist in the selection of the drug products and the identities. And he will monitor patients' total drug therapy as well as counseling the patients on for the medications which can be self-administered, and for regarding the use of the discharge medications. Next, they will also help in cardiopulmonary emergencies by procurement of the drugs, then charting all the medications, and even they perform the cardiopulmonary resuscitations. Lastly, is the general responsibilities. In this, the pharmacist will be responsible for providing training and education to the pharmacist, to the pharmacy students, then to the nurses and the nursing students and Lastly, they will be giving training and education to the physicians and to the medical students. So in the last is the outdoor pharmacist responsibilities. In this also there are three categories, actually four, but they have clubbed and presented in three categories, that is central dispensing area, patient care areas, general responsibilities. So in the central dispensing area, the pharmacist will be having the same responsibilities. So these are the central dispensing area. This is the central dispensing area where the pharmacist will ensure all the things like the proper techniques are used or not, the adequate record keeping and billing, then prescription files maintenance, then neat and tidy manner, keeping of the outdoor pharmacy in a neat and tidy manner. Then patient care area will be there, and lastly the general responsibilities. So these are the things of the pharmacist.